Welcome, Bea and Dr. Wilson. We are very happy to have you here today. I want to start off by basically saying the definition of gaslighting, because it's a bit of a trendy word now. It was the word of the year last year, and it tends to be kind of misused. So I want to start out with talking about that. So gaslighting is the psychological manipulation of a person over an extended period of time that causes the victim to question the validity of their thoughts, perception of reality, or memories, and typically leads to confusion, loss of confidence and self-esteem, uncertainty of one's emotions or mental stability, and ultimately the dependency on the perpetrator. So, Bea and Dr. Wilson, tell us a bit about yourselves and how you've experienced gaslighting by a medical provider.
I guess I'll start. So, hello everyone. So my name is Dr. Tracy Wilson. I am a doctorally prepared family nurse practitioner. And so you would think that being a healthcare provider that I should be experienced, I should know how to handle myself when I'm in an actual, engagement with a healthcare provider. But my own personal experience being with a healthcare provider actually led me to have my own experience with medical gaslighting. And so back in 2015, I actually had flu and strep throat at the same time. But actually being with a healthcare provider led me to have my own experience. And this healthcare provider dismissed me when I told her that I had neck stiffness, I had a fever, and she said, well, okay, that's fine. And I said, well, do you think that it could be meningitis? And she said, oh no, you're not sick enough. And she sent me on my way. And 2 days later, after going to another emergency room, after I wasn't feeling any better, another healthcare provider listened to me and actually did the necessary testing. It actually showed that I did have a form of meningitis. Thank God that it wasn't bacterial meningitis. And I was in the hospital for 4 days and was able to go home back to my children. But had it not been, for the grace of God, and had this medical provider not treated me the way that it needed to be done, I would not be with you today. So that was my experience with medical gaslighting.
I think mine was when I had bacterial vaginosis for almost a year, and I would continuously go back to the doctor every single month because I didn't understand why it kept coming back, And they just kept telling me that basically all I need to do is take the medicine, right? Which would be either metronidazole, otherwise known as Flagyl, or clindamycin, which was the gel, and it was disgusting. And, and they were like, all you need to do is take this medicine or put this inside your body, and then it's gonna go away, and you're gonna be fine, right? And literally every single month, I swear, bacterial vaginosis keeps OBGYN family medicine doctors open because it's insane. She's over here blinking at me because it's true. But I really wasn't, there was no desire to figure out what was actually wrong. Nobody was saying to me, your pH is off. What are you doing on a daily basis to try to figure out what's going on? Nobody was saying that to me. But then again, they may not have been saying that because they may not have even known themselves, And so, I think, I'm sure that there's other ways that I've been gaslighted, but some things I just blank out of my head, but I think that was probably the most traumatic, because I was always so embarrassed. I always had an odor. It was just always really bad, and it was hard. So I think that's probably one of the hardest moments, which, I'm grateful that my coochie was acting up because we wouldn't be having this conversation on this stage. So it all worked out.
Absolutely.
So, B, for you, it ultimately led to the launch of your business.
Yes, it did. It did.
Because you found your own treatment. Tell us a little bit about that.
Well, it was given to me. My grandmother, who had been walking with me and seeing me struggle, and she told me that. She said it's actually kind of hilarious when you think about it, because she was like, I have been seeing you struggle for the last year. My grandmother died, you guys, when my mother was 8 years old, right? And so I never really physically met her in real life. And I shouldn't say in real life. I didn't meet her on this dimension in this plane, right? But she told me that she was watching me struggle. And she was like, I just needed to come and help, you know? And she handed me a piece of paper, and it had a list of ingredients on it. And she told me that I needed to basically make myself something from what was on the paper. And so in the dream, I just repeated over and over and over again what was on the paper until she told me to wake up. And when I woke up, I wrote it down. And then I used to work in pharmacy. So I used to be like a compounding pharmacy technician. I worked in IV rooms. I did all that kind of stuff. I did that for like 10 years. I worked in chemo labs. I did compounding for skincare. So she knew that if she gave me the ingredients that I'd be able to figure it out, right? And I did. And she gave me the ingredients. I went to work because I worked at Whole Foods at the time. And I bought all the stuff, and then I made myself a formula because I had BV right at that moment. And then I started using it, and literally within 4 to 5 days of using it, it was gone. It was like magic, you know? And it was that moment that I realized that actually going pee, I realized that I was actually fine. And I said, this is what I do now, you know? And so, yeah.
And here you are.
And here we are. Thank you, Grandma. I love you.
So, in a recent survey that we did with Pfizer at the end of last year, we found that 72% of respondents said that they had felt gaslit by a healthcare provider. So this is really prevalent. I think especially in a system where, you know, doctors are feel forced to like push in and out patients like all day, you know, because they're trying to bill insurance companies. Our system's overtaxed. So it's very common. And a recent study reported by the New York Times said that women and people of color were more likely to be dismissed by a medical provider for their symptoms. So tell us a little bit more about what you felt when you were being gaslit. I know I've felt diminished. I felt my symptoms have been diminished or dismissed. Tell us a little bit about that.
I think when you're in the midst of being gaslit, I think what you are feeling is unheard. You feel that you're not being seen. You feel that that person is not listening to you. You feel like your concerns are not validated. And for a lot of times, you feel that that you're crazy, that my reality is not my reality. So it can almost put a person into a mental health crisis for a lot of people. I know that I have a relative that went for years before their diagnosis of lupus took place. And it literally put them into a mental health crisis because I know that I'm not crazy, but the healthcare provider that they were seeing made them feel literally crazy. So I know that a lot of the things that I just kind of explained, those are the things that you can feel when you're being gaslit, and especially medically gaslit, that healthcare provider can sometimes make you feel all of those various things.
But the problem is that the medical industry is built for symptoms, right? It's not exactly built for wellness, you know, like it's built for basically treating symptoms, right? And not necessarily getting to the cellular level of actually what's going on. And I mean, even the tests that we have to do. I am an Eastern and Western medicine believer, right? If I have a functional doctor that basically has a respect for both sides of it, right? Which I think is necessary, because you can't have wellness without nutrition, but also you need some medicine sometimes.
That's
you know,
true. Very, very true.
You know, and so I think when a whole system is built on that, and then, you know, and especially when you're talking about Black humans with vaginas, and people of color, when you have a system that was also systematically built on the narrative that Black women are stronger, right? When you look at the history of obstetrics and gynecology, because I won't even say his name, but where he actually went and watched midwives in Africa, watched them do C-sections, right? Went home, practiced on his own slaves without an ounce of anesthesia, without an ounce of pain medicine. And then he would go and he would take the learnings that he did from his slaves, right? And then he would go and practice on white women, where he would give them medicine and he would give them anesthesia. And so there was a narrative that was built around Black women being stronger, right? And literally was written in medical books. So, you know, when you've got a culture that was built on that type of a foundation, it's not crazy to think that it's a profession or it's an industry that's gonna gaslight. How can you not gaslight when that lays at the foundation, and when it's just now that medical books are starting to change, right? And so, you know, whenever we're thinking about these things, you have to go back to, well, how did it even begin, right? And it's not crazy when you actually look at the foundation, you know?
100% true. There needs to be, you know, really kind of a systematic change.
Yeah.
So in the survey, we also found that 28% of respondents felt like they had been stereotyped for their race, gender, or background. I certainly feel like my background has been ignored in situations with my doctor because I am Latina, and they didn't factor that into my care plan. Have you felt stereotyped by a medical provider?
Of course. But like, it's absurd though. You should not be classified by your culture or your race or your skin color. You are a human being, you know? I think everybody in this audience has probably experienced some level of that, you know? And it's ridiculous. But the thing that's important to remember is that when that happens, you have the right to call it out, right? You have the right to say, you shouldn't speak to me that way, right? You have the right to say, let me call somebody on the phone so I can get somebody else to hear this. Or pull out your phone so that you can record it, right? There are things that you can do, or even bigger than that, you can go to your insurance company or whoever you need to go to and say, hey, this doctor is not serving me, and you know, and I need somebody else, you know? Unfortunately, we shouldn't have to tap into those kind of resources, but it's important. That's why it's important when you go to the doctor to make a list of what you're there for, right? And why do you need to be seen, and what are the tests that you need, and what are the prescriptions you're taking, and what is the foods that you're eating. And you need to understand all these things when you go to see a medical professional so that you can give them a full picture, and don't even give them the opportunity to bullshit you, right? It can happen, doesn't mean it doesn't happen, but we have the power to speak up for ourselves.
And know that a lot of times these things are really subtle.
Yep.
You know, so, you know, these things are not going to be blatant and right in your face. So understand is a lot of these things are going to be your instincts. So go with your instincts. If it doesn't feel right, then know that your gut is going to tell you that this is not feeling right, then I need to speak up. and then address the issue that you're feeling. So exactly what Beatrice is speaking about, that if your instincts is not feeling right, then speak up, say something, call it to the floor, call it to action, and then address it with the healthcare provider at that particular point.
Especially if it's an emergency. Like if it's an emergency and you know that something's not right and everybody is saying that nothing's wrong, but you know, like do what you have to do. If they think you're crazy, be crazy. Let your seriously, because so many people have died because they bled too much. So many people have been like, something's wrong, but I don't know what it is. And then they go get on an airplane or something, and then they, and because people, if they're not hearing your pain, do not let somebody else tell you what your pain is. Nobody can tell you that, right? Why do you think this pain management business is so colossal, right? When it makes sense for them financially, shout out to Oxy, shout out to Percocet, shout out to all the things. Not because I have a respect for them, but in those instances, you can go to a pain clinic and get all the medicine you want because it's filling somebody's pockets. But understand that when it comes to your body, right? Don't let anybody tell you that what your circumstances are, because only you know that,
And we have just, the perfect examples, famous examples of medical gaslighting that we've seen. So we've seen Serena Williams.
Yep.
We watched that and we seen what her example was when she had her daughter Olympia. She had, long history of pulmonary embolisms. And when she gave birth to her daughter, she called it to the carpet. She told them, I'm having chest pain. They were not listening to her. And she had to literally yell from the rooftops that I'm having the same symptoms. And then finally someone listened. And when they finally did all the necessary testing, she had several blood clots, pulmonary embolisms in her chest. And they finally addressed them. We have another lady, Dr. Susan Moore. She filmed herself when she was in the hospital with COVID and eventually died during the peak of the pandemic. You can look at her story, you can Google it and watch her literally die from COVID, being medically gaslit because the doctors were not listening to her. They have literally changed the hospital system in Indiana because of her. So we have literally stories and stories and stories of women of color because of healthcare providers not listening. Again, I'm a healthcare provider, so I'm never going to sit here and let anyone kind of bash the healthcare system and healthcare providers. But just know that we have to do better.
So what does culturally competent healthcare mean to you? What would that be?
I think for me, what it kind of looks like for me is just ensuring that the care that we provide is looking like the patients that you're taking care of, that you're getting into the communities, that you're talking to the people that you're taking care of. That's one of the things that looks like culturally competent care for me. And it's also that, that the social, cultural, and then also the linguistic needs, that you're understanding the language that the patients, that they're speaking, that you're understanding those needs as well too.
I think it's treating people like humans, I think it's important to understand, what's actually, I said it earlier, what's actually happening in somebody's life, right? Understanding what's happening, I'm in the vagina business, so I'm a little more sensitive to hormonal balances and menstrual conditions and things like that, right? But these are all things that are extremely important, as it relates to any kind of a dis-ease, understanding what's happening with your hormones, understanding what your food allergies are, right, or what they're not, understanding what's happening with your body, understanding what's happening with your cycle, understanding what your genetics are and what, and what your ancestors have gone through. Does cancer run in your family, right? do embolisms run in your family? You know what I mean? Like, all these things are really important. It's really important for us to know what's going on in our family, what our histories are. You know what I mean? You know, and for me, it is taking more of a functional approach of looking at you as a being and not comparing you to a human that doesn't have your same body makeup, doesn't have your same, you know what I mean? Because, you know, then you're actually treating somebody like a human being, you know? And I think that it's really important, you know, like you said, the healthcare system is necessary. I have a respect for it, you know, a profound respect for it. I wanted to be a doctor, you know? I just turned out to be a natural healer, you know? But I do think that there is a big shift that we would have to take, you know, as a human race, as a whole systematic approach in order to get to the place where it's different.
One thing we also saw in our survey was that a lot of times patients just didn't know how to articulate their symptoms or what they were feeling. Dr. Wilson, tell us, from the other side of the story, you know, tell us what healthcare providers are facing in their encounters with patients. As patients are coming in, trying to describe things, and they're trying to do their best.
Absolutely. So I would say, number one, there's just not enough time. So that's one huge issue. The other thing is what I would call the medicalization of healthcare. So, you know, when we're taking care of patients, there is, you know, the business of it. There is, you know, everything from the billing, reimbursement, all of those issues. When we're trying to take care of patients, it's just the business of it. And so those kind of issues. And then you also have fear of lawsuits that's taking place. So when you have the patient, you know, that's complaining, and then now that's hovering above your head, and then this patient that's gonna complain, and then, well, I'm gonna sue. So you're trying to do everything the best that you can, and then the patient that may potentially sue, that's lingering also in the back of your head. So you have this business, you have insurance, you have not enough time, all of these confines that's now playing into the healthcare system. There's just a lot of wheels in the cog that's going on. And I would just say, as a healthcare provider, I would say, as just human beings, extend grace to each other. You know, extend grace to the patient, and then to the healthcare provider, extend grace to the healthcare provider as well, too.
I totally agree with that.
So, B, you mentioned like taking note of your symptoms, like writing them down. What are some takeaways that our audience can go away with to improve communication for their next doctor's visit, and hopefully be heard?
I think creating a relationship with who it is that you're going to is important. You know, like, actually, like, maybe treating them like a human being, right? Like, how are you doing? How are you feeling? You know, those kinds of things go a long way, you know? Especially if you have a doctor or healthcare professional that doesn't have the best bedside manner, you know? Sometimes that may be because they do something that is a very heavy thing. Like when you see doctors that are treating brain, you know, the brain or the heart, you know, sometimes they may feel a little cold, but they kind of have to because they're dealing with things that are so substantial, you know? But that doesn't take away from the fact that they may be an amazing, probably one of the best doctors, right? So I think trying to see them for trying to, like you said, extend some grace. I think when you go in, really understanding what you're going in for, you know, try to take somebody with you to the doctor. If you can't take somebody with you, then call somebody on the phone, like I said, or or record it on your phone. Make a list of what you're going in for. Understand what happened the last time you were there, and try to pick up from that time. You know, because wellness is a process. You know, it's not when you think about what it takes for you to become unwell and how many years that may have passed by in order for you to get to where you are, whether that's food related, whether that's stress related, whether that's just because it runs in your family related. When you think about how long that takes, it could be 20 years, it could be 30 years, it could be 40 or 50. That cannot be reversed like that. That takes time to reverse. So also giving yourself grace and just going with the flow in the process and not trying to rush it, you know? You know, and you have to be willing to do the work and to have the discipline. Because if you want to have supreme wellness, again, that takes time. But if you know you're not supposed to be eating something, don't eat it all the time. You understand what I'm saying? If you know you've got high cholesterol or diabetes or, you know, high blood pressure from time to time, you really should have a respect for that, because no doctor can do that if you're not going to meet them halfway. They can give you the information, but you have to be the one to exercise it, you know? You know, and I think also drinking water and eating vegetables and getting your fiber, you know, and moving around a little. Understand that nobody can really be the sole fixer for you. You have to really take the lead, but I think you do need to be organized and structured, because when you go to meet with your doctor, there's business transacting. This is the business of your health, right? And that's not something that should be taken lightly.
There's two things I just want to add to that. Everything Beatrice just said is exactly right. The only two things I want to add to that is don't leave your appointment until all your questions are answered.
Yep.
Do not leave. And then the last thing, you have a right to a second opinion.
Yep.
Because your very life is going to depend on it. So those are the only things I want to add.
Okay. Thank you so much.
Thank you.